morning. I am Dr. Anil Garg. I am going to present the pattern hair loss, the current perspectives, and evidence based medical treatment and update. This presentation was done by me in annual conference of Association of Hair Restoration Surgeons of India during HairCon 2020 Mumbai, February. I have done MS in General Surgery, MCH in Plastic Surgery. I am Fellow of International Society of Hair Restoration Surgery and Diplomate of American Board of Hair Restoration Surgery. I have been a teaching faculty and attended various international and national workshops, conferences, and have been presenting papers as faculty. I have also written chapters for many books. I was the co-editor for the book written by Dr. Venkat Mysore in 2016, and recently we have published our own book on for hair restoration. So let's start the presentation. What do we expect from any therapy? Because one should understand any medical treatment when it comes to deliver to general population, it has to go through various trials, and you must be aware of this: phase 1, phase 2, phase 3. And also various studies are also done to know the effect of these, and on that basis the scientist and a group of scientists makes the recommendation. So based, that's called as evidence base. Means if you are giving any medical treatment, how much is the evidence in favor of treatment of that particular disease for which that drug has been advised. So what do we expect from any therapy? Means the therapy or that medicine should be able to prevent the progression of the disease. Like if we talk in terms of hair loss or androgenetic alopecia, then the control of miniaturization. Then efficacy to improve from existing condition means the reversal of miniaturization. In case of androgenetic alopecia, how safe that drug is for the patient, and is the patient is able to take them, means user friendly, practicability to the patient we call it, and also practicability to the physician to prescribe and to explain, and the scientific basis of proving all above which I stated. So on these 6 points parameters we decide about any therapy for a particular disease, as we are talking in here in terms of androgenetic alopecia. There are the two main studies published by European Dermatology Forum, and another is the Japanese Dermatological Society. They collected the various studies, scientific paper published in peer-reviewed journals, collected all the data, compiled them, and based on all those evidences, they established some guideline for the treatment of androgenetic alopecia for male and female both. So this is the European Dermatology Forum guideline received on May 17 and accepted in September 17. The European Dermatology Society developed an evidence-based tool for choosing an efficacious and safe therapy for patients with androgenetic alopecia. Similarly, Japanese Dermatology Society also gave the guideline for the diagnosis and the treatment of male and female pattern hair loss. This was also published in 2017. This was the 2017 version, but it was published in Journal of Dermatology in 2018. So European and Japanese Dermatology Society guidelines usually we follow. So, how to decide which therapy to recommend based on the evidences? So, they are the three things one has to understand. Many times, even the doctors are not able to understand, and for a general population, it's a knowledge to them that how do we decide, how do we go to recommend or not to recommend a drug for particular problem. So evidence-based assessment is based on for a study, means someone has done the study for something, what quality of a study he did. Based on that, we give them the grading of A1, A2, B, C, and D. So this is for the study. Then the level of evidence is based on a particular regime like minoxidil, finasteride, dutasteride, low light laser therapy. How much is the level of evidence that drug has got to treat miniaturization or for the reversal of miniaturization? The grading is done 1, 2, 3, 4. Then, based on the above evidences, a group of scientists make the recommendation, means they can recommend that that particular drug for a disease is recommended, or they suggest, or they can, that medicine can be considered, or we suggest not, do not recommend, and we cannot make any recommendation. So these are the recommendation, type of recommendation the group of scientists makes for a particular disease, particular medicine to treat a particular disease. So what we are going to talk is for the treatment of androgenetic alopecia for male and female, and also the pathogenesis of pattern hair loss evidence base. So the exact pathogenesis is still incompletely understood, as there is a variation in the pattern as well as the difference in the response to the current modalities of treatment. Exact pathogenesis is still not known because why? The medicine which has been recommended now and being used do not give the same response to the all population, and the pattern of presentation of the pattern hair loss differs from one person to another, although most of them follow the common pattern but few do not. So the response of the treatment as well as the presentation of the disease is differing, indicating that there are many other things which we are not aware of, which we could not find out. But few things has been clear by now, that there is a genetic predisposition and role of androgen in male pattern hair loss. And female pattern hair loss is a little more complex. The genetic predisposition has been established, but androgen is not, because there are many female pattern hair loss in which the androgens are normal, hormone levels are normal, but they differ in the presentation. So, one conclusion was taken out that female pattern hair loss have got the genetic basis, but it can be androgen dependent and it can be androgen non-dependent. So these are the two important things, two conclusion which has been drawn till date. The pathogenesis of male pattern hair loss evidence for genetic basis. The monozygotic twins study was done. 80 to 19% concordance rate was there. Osborne did a study and he proved that it's autosomal dominant. It is polygenic. Multiple genes are responsible, but the main gene which has been found out is the AR genes. AR gene located on the mother component of the X chromosome. The higher expression of AR gene in the balding scalp is there. Men with abnormal AR gene like Candice disease do not develop the male pattern hair loss. So the studies based for in the favor of genetic cause for male pattern hair loss is that multiple genes, autosomal dominant, the AR gene is mainly responsible, situated on the X chromosome, and there is a higher expression of AR genes in a balding scalp, and also the patients who do not have the AR genes, the disease is called as Candice disease, in which AR gene is absent, they do not develop the male pattern baldness. So, this proves that there is genetic evidence for development of male pattern hair loss. Now come to the second point, कि androgen, do the androgen play role in male pattern hair loss? Testosterone is converted to DHT. This conversion is done by an enzyme that is called as type 1 and type 2 5 alpha reductase. Type 1 alpha reductase is found in prostate and sebaceous and pilosebaceous gland, while type 2 is found mainly in the prostate, outer root of outer root sheath of follicle and the dermal papillae. Means this is mainly present in prostate and hair follicle. The research data says that DHT is principal causative agent. ER receptor has 5 times more affinity for the DHT as compared to testosterone. So DHT is a more potent androgen playing role in the hair loss. The men with genetic deficiency of 5 alpha reductase type 2 do not develop male pattern hair loss. The balding scalp has higher level of 5 alpha reductase than the non-balding scalp. The pharmacological inhibitors of 5 alpha reductase like finasteride and dutasteride are effective in the treatment of male pattern hair loss. So many evidences are there which proves that there is a certainly role of androgen in male pattern hair loss, and when any chemical agent like finasteride or dutasteride which causes the inhibition, competitive inhibition of alpha reductase, which is responsible for the conversion of testosterone to DHT, also controls and prevents the miniaturization, means it's treating the male pattern hair loss. Now we come to the female pattern hair loss, the androgen basis. The androgen basis is not as strong as male pattern hair loss. As I recently spoke to you, that male pattern hair loss, the androgen has been proved, but for the female, there are not so much strong evidences. The majority of female with female pattern hair loss do not show androgen abnormality. Women with hyperandrogenism frequently develop female pattern hair loss. So this is something reverse what I am talking. In previous statement I said that female having the female pattern hair loss, androgens are normal. But the females who has got androgen abnormality, means higher level of androgen, they frequently present with the female pattern hair loss. There is an inverse relation of circulating sex hormone, globulins and degree of hair loss. Means there are some globulins which binds with the sex hormone, making it less availability of female with these androgens. When these androgens freely are not available to develop, not then when these androgens are not available in the blood freely, then this prevents the female pattern hair loss. Means the androgen has got role. Then another thing is the enzyme aromatase level is 5 times in the scalp of women than in the men. Enzyme aromatase is a hair loss preventing enzyme, and if anything which blocks the aromatase, it induces the female pattern hair loss. So you saw that certainly there is some role of androgen in female pattern hair loss, but not in all the cases. So scientists came to a conclusion that female pattern hair loss can be androgen dependent and can be non-dependent as far as the pathogenesis or the cause of female pattern hair loss is concerned. Now, the female pattern hair loss evidence base. The 54% of female with female pattern hair loss has a male first degree relative with AGA. So now we are proving that female pattern hair loss has got a genetic basis. For that, when the studies were conducted, they found that 54% of the female who are having the female pattern hair loss has got their first degree of relative like their brother who has male pattern hair loss. So something is common in both of them, both brother and sister. So that's the genes. Then the 20% of the female with female pattern hair loss has a female relative with female pattern hair loss. So two sisters, the chances of female pattern hair loss among both sisters will be 23%, or we can say that we have found 23% of female presenting with female pattern loss, their sister is also having the female pattern hair loss. So what's common in them is there is a genes. Some genes are common in brother and sister. So 50% of brothers are having male pattern hair loss and 23% of the female patient has got a female sister having the female pattern hair loss. Another important thing which was found that the variation in the gene CYP17 is found to be same in PCOD and male pattern hair loss, which says that PCOD is a female phenotype of male pattern hair loss. So PCOD, there is a problem in a gene, the CYP17. It is same. This same type of gene is found in the patient, female patient who has PCOD, and the patient, male patient who has got male pattern hair loss. In both of them, the same gene variation was found, that was CYP70. This also indicates that there is a possibility of genetic basis in the female pattern hair loss. So these were the evidences for the male and female pattern hair loss, showing there is a genetic basis and androgen basis, both has been proved in male, while there is genetic basis that has been proved in the female pattern hair loss. And for the androgens causing female pattern hair loss, there can be two types. One can be female pattern hair loss androgen dependent, and there can be female pattern hair loss which is androgen independent. So these were the evidences for the female and male pattern hair loss. So today's my talk, this was the part 1. I am finishing here and I am continuing in the part 2, in which I am going to tell you the evidence for the treatment of male and female pattern hair loss. Thank you. So you continue for the part 2 if you are interested.